I want to welcome you to this moment, the episode that we started with our last video on preventable death. We've heard that there are a lot of death being experienced today, but there are some of those deaths that could be prevented. Referring back to our last video, I did talk about controllable and uncontrollable factors, and these are factors that could lead to death. But regardless, as long as we put our health as first priority, we can still prevent such death from happening. Today, I want to talk about smoking, which is one of the examples of controllable factors that was referenced in our last video. According to the fact sheet extract of World Health Organization of June 25, 2025, it's been said that tobacco smoking kills more than 7 million people every blessed year. And from what we was told in our last video, it's going to increase by the year 2023. And added to the aforesaid is the fact that there's an estimated 1.6 million non-smokers who are exposed to secondhand smoke. And this increases the number of deaths per year. Funny enough, we have a global world where the negative effects of a neighbor who smokes goes to affect another neighbor who does not. And the fearful key fact from World Health Organization extract of that same June 25, 2025 is the fact that there is no safe level of exposure to tobacco. One thing about the chemistry of hemoglobin and carbon dioxide that exudes from smoke is the fact that the carbon dioxide bind to the hemoglobin and gets stuck there. So there will be no binding site for oxygen, which the body requires, making the carbon dioxide to fill the entire blood system. That is complicated. Unfortunately, my concern is that of secondhand smoke, where non-smokers are exposed to cigarette smokes, especially smokes that fill the restaurants, the offices, homes, name it. Surprising to you, right? For those who do not smoke, what do we do? That's a big question to ask. I'd like for you to leave your comment down below. It's been documented by World Health Organization that secondhand smoke causes disease that are led to 1.6 million people dying prematurely annually every blessed year. One may be wondering, why would someone who does not smoke would die from serious cardiovascular disease, would die from respiratory disease, would die from coronary heart disease, and even lung cancer? That is frightening, right? I have many times heard advert that people that smokes are liable to die young. And I would like for you to leave a comment down below suggesting why you think people still smoke regardless of the advert. And secondly, also leave a comment as to what you think should be done to create a better environment to live in terms of reducing the preventable death from tobacco. I would like to see your comment so that we can stretch it further from there. Otherwise, I will see you in our next video. Thank you. Bye for now.